Thank you so much, Blaine. The latest outbreak of Ebola virus disease is affecting northeastern provinces of the Democratic Republic of Congo, which are in close proximity to Uganda and Rwanda. The country is concurrently experiencing several epidemics and a long-term humanitarian crisis. Additionally, the security situation in North Kivu may hinder the implementation of response activities. For more, we joined and honored to welcome in our studio Dr. Matshediso Moeti. She is the World Health Organization Regional Director for Africa. She was recently in the DRC spearheading efforts at containing the Ebola outbreak, as well as ensuring that vaccination processes are efficient, particularly for the work of the World Health Organization. Welcome and thank you so much for making the time.
Thank you. Thanks for having me.
Let's just remind our viewers about the work of the World Health Organization. What does it do?
Yes, the World Health Organization is part of the United Nations. We are a technical agency, a member state organization, and I would say in a nutshell that we support countries to establish good healthcare systems that can prevent diseases, including preventing outbreaks like this Ebola outbreak, that also make sure that everybody, every citizen in every country has access to health services for the priority health problems that afflict populations. So we advise in terms of policy, instead of strategy, in terms of programs. We play a very important role in monitoring what is happening in health. So we help countries to develop their data systems so that they know what are the disease patterns, and they can also establish and evaluate if the programs that they are implementing are having the impact that they want. And most importantly, we also mobilize partnership. We realize that as WHO, we can't be the only agency or entity working with countries. So we help governments to coordinate the partners that work with them. And then we also encourage research. We don't carry out a lot of research ourselves, but we encourage, promote research so that new technologies are discovered, new ways of doing health work are discovered, all in the interests of improving the health of populations worldwide.
We have unique challenges in South Africa, but you have the advantage of dealing with multiple countries. Are you finding that governments are overcoming the challenges in the public health provision space?
Governments are working hard on this. We see very different, how can I say, development areas in terms of how different countries are doing. One of the things that we have to acknowledge is that across Africa in general, governments need to prioritize health better. And this is in countries where they have economic challenges, as is the case in many African countries. We work in the region with 47 sub-Saharan, mainly African countries. There is a lot of competition between what are seen as development sectors, you know, infrastructure, agriculture, so-called productive sectors, and some of the social sectors that in the past have been seen as more consuming than producing. Now it's increasingly understood that without human capital, you can't develop economically. So, but we still need to have a bit more money invested in health, domestic funding. That's one of the big barriers that I see.
That's an interesting way to look at it in an era where we think that technology is surpassing human capital. So not really.
Well, I think that technology is guided by humans. Even in this competitive context, it's true where we see artificial intelligence, mechanization, more and more replacing lower skilled jobs. I think that we still need human capital, we still need innovators, we still need brains to work and to guide what the technology is going to do for us.
When a person, when we have a person such as yourself in the studio, one is tempted to digress, but we'll try our best to keep to the conversation, which is about Ebola. But we're talking about Ebola today, but what are the other health scares throughout, especially the continent, that we should be looking out for?
Yes. Our continent is primarily affected by communicable diseases still. One of the biggest ones is HIV, which is a major problem in South Africa, but it continues to be the #1 killer of African people. Tuberculosis is also a big problem, and we're very concerned about the emergence or the reality of resistance of the bacterium to the antibiotics that are being used. Malaria continues to be a big problem, and we just noted in the global report on malaria, in fact, that after some years of making progress,
with all the work that has been put in.
Yes, but that now we are stagnating a little bit, and we've got 10 African countries that carry the heaviest world burden of malaria.
Yeah.
At the same time, we are transitioning to a big problem of chronic diseases, hypertension, cardiac diseases,
and lifestyle
cancer,
diseases.
yeah, which are emerging, and in a very short while are going to overtake these infectious diseases causing deaths. So our countries have to contend with a very complex picture of health, and compounding that is the fact that we have weak health systems. So part of the reason why Ebola, for example, spread so far in West Africa is that it was spreading quietly in a corner of the country where really there wasn't much presence of the public health system.
Yeah.
By the time it was detected, many people had died, it had spread to cities. So we have a heavy disease burden, we have weak health systems, we need better investment, not only increased investment, but also smarter investment in prevention, in public health interventions, as well as in developing care and treatment capacities in countries.
The mere mention of Ebola elicits fear.
Yes.
Does it do the same for professionals? What do we know about Ebola?
Well, it's a very infectious disease, and it's got a high mortality. So at the moment we're seeing almost 50% fatality of those who are infected. I think of course it's a very painful disease. It's a dreadful way for somebody to die. People are hemorrhaging from everywhere by the time that they are dying, and it can kill very quickly. So it's a very dramatic clinical picture, and it is a highly fatal disease. So we also ourselves are very concerned whenever there is an outbreak of Ebola, and we make sure that we mobilize all the capacities to bring it under control.
Tell us about your work in the DRC.
Yes. You know, the DRC has been a very particular experience. A year and a half ago or so, there was an outbreak in an area called Likati. So I went to Kinshasa, and we worked with the national authorities on how to control it. That was very quickly brought under control. It was in the northern part of the DRC. And then in May this year, there was another outbreak in the northwestern part of the country, that's in a very remote area, quite a difficult context, which involved huge investment in infrastructure to be able to get there, and working with many partners. We were celebrating the end of that not very long ago, and I went together with the Director General for those ceremonies. And then at the end of July, there was another in the northeastern part of the country now, case of Ebola. So it is an issue. It's a disease that is present in the environment. The virus is there. Mm-hmm. I think the onus is then on us to support this country to have very good surveillance systems, public health systems that can detect, diagnose, and bring under control Ebola very quickly. One of the challenges we have faced in this current outbreak has been the number of healthcare workers that have become infected in Beni and in Mangina. Mangina is what we call the epicenter. This is where we've seen the largest number of cases. So it reminds us that we really do need healthcare systems where health workers are not exposed to risk before they know that the person they are treating has an infectious disease like Ebola. I think it really underlines the need for investment in good healthcare systems towards what we call universal health coverage.
Just as we wrap up our conversation, let's quickly talk about the African Health Ministers meeting in Dakar that you're going to be attending. What will be your contribution there?
Yes, in fact, we are convening this meeting. It is a meeting of the so-called regional committee. It's an annual meeting of health ministers who act as a governing body to WHO. So they review our work as a secretariat, ensure that we are delivering, and it's a mutual accountability story where we also, because they adopt resolutions in those meetings, we then see with them how are they doing in implementing what they have committed to doing. So we'll be talking about a number of issues, including our work on health security and on controlling outbreaks. We'll be talking about non-communicable diseases, and really it's a way to monitor with our governments if they're fulfilling their commitments to health in the way that they discuss with us in WHO, and they in turn want to see how we are working together with them to support them to reach their objectives.
Dr. Moeti, you work for an organization that's globally based, but in South Africa, August is Women's Month. Well, what are your views on this commemoration?
I think it's a huge opportunity to celebrate women, first of all, because we've come a long way. I think women have come a long way since those days of the suffragettes and people waving around for the right to vote, for example. But it's also the opportunity to recognize that we still have to make a lot of progress and much needs to be done in the way of policy, legislation, changing the culture in a sense, and mostly empowering women so that we seize the opportunities that are offered and we insist on additional opportunities being made available for women in all spheres. In health, in a context of a country like South Africa, we want to see women's equality being expressed in reduced risk, for example, of young girls to sexually transmitted infections because they reflect power differences between males and females. We of course want to see women leadership in setting policy, in making sure that programs are working, because I believe that women bring that additional element to all the work that we are doing that reflects our role in society, not only as technicians, but also as mothers, as sisters, as caregivers, really, and provide a rounded approach, I believe, to the work that we do at home, in communities, and also internationally and in the public space.
We know you have a tight schedule. We thank you so much for your time. Dr. Matshediso Moeti is the Regional Director for Africa for the World Health Organization. Thank you so much for making the time. Let's take a look at the weather now.